the memory. So clubfoot is a congenital triple deformity of the baby's foot, usually detected at birth, with an occurrence of 1 to 4 per 1,000. It is the most common birth defects. It can be bilateral or unilateral, mild or severe. This triple deformity, known as clubfoot, occurs in 3 planes of the space. On the first plane, the frontal plane, varus of the hind foot, which is the major deformity. On the second plane, the transversal plane, medial rotation of the calcaneopedial block, which is an adduction of the forefoot. On the third plane, the sagittal plane, the ankle equine, which is a plantar flexion of the foot with Achilles tendon shortness. Clubfoot is also known under the name of Talipes equinovarus. The 3 deformity is shown here in the picture. You can see it. The foot goes down and in. So here we are, Mili methods for clubfoot. First of all, let me introduce Mr. Mili, a small and quick biography. So Dr. Fraj Mili is a Tunisian physiotherapist with over 40 years of experience in the field of neuropediatric. He is known as the specialist of congenital distal deformity in babies, such as foot and hand. He worked as a chief of pediatric rehabilitation department in a public hospital in Tunisia. And nowadays he works in his own clinic specialized in neuropediatrics. Mili method birth. Dr. Mili invented his technique on treating baby clubfoot in 2008. He won the Super Prize of Tunisian Inventor the same year for this revolutionary technique. Let's have some statistic. So patient benefits of Mili technique are over 1,200 patients, 100% of success when the treatment is done within good conditions, 1% only of failure or let's say imperfection due to wrong treatment conditions. Only 5 countries in the world are benefiting from this method. 5 countries which are Tunisia, Algeria, Morocco, Libya, and Italy. This method has 4 approaches. The first approach is in utero treatment. That means the treatment starts before baby's birth, almost at the 3rd month of pregnancy. The second approach is the newborn approach, which starts treatment at the 1st week, sometimes before 3rd day or 4th. The third approach, which is for severe and complicated clubfoot, it starts at 6th month. And the 4th approach is for the inveterate clubfoot, the cases that has failure of any passive correction attempts. So I will be only describing the second approach, which is only considering the newborn, because of lack of time, and it's not possible to go through all these approaches in only 15 or 20 minutes. So how does it work? This method has reversed the principle of treatment of distal congenital malformation. In fact, the treatment techniques goes from passive isometric to active dynamic. This allows the physical therapist to treat this deformity without pain and damage of the skeleton, the foot skeleton, the bones. Mili method uses hypoallergenic tapes to correct the deviation and goes beyond the foot and ankle for better action. When I say beyond the foot and ankle to better action, I mean he goes on the knee. Start the treatments from the knee. As the tape is flexible, this allows the baby to move well and gives him a certain degree of freedom in motion. The baby then actively corrects the position of his foot by controlling the pain threshold and without hurting himself. This method highly respects the morphogenesis of foot bones. That explains why Mili starts his correction by the beginning of the foot morphogenesis. As a conclusion of the table, I can say that, the first two methods, Ponseti and French, start the rehabilitation by the third week after birth. They both concentrate on treating the major deformity, which is the varus, while the equine is left behind for an eventual surgery later in 50% of the cases. Achilles tenotomy. Mili method has 5 major innovations: dynamic and active, with self-control of pain threshold, active traction of the calcaneus. That's why there is no need for surgery for the Achilles tendon, and continuous functional self-education, and this special simultaneous correction of the 3 components of the clubfoot. The 3 components, I mean the varus, the equine, and adductus. The 3 components are simultaneously corrected by the Mili methods. Description of the foot morphogenesis. And I would like to invite you to know more about Mili method. You can reach out to him by email. This is his mobile and site.